It's a good morning to you. Welcome to Asake Online. My name is Zenzele Ndebele, and this is the Breakfast Club. We continue with the second episode of our program, Unpacking COVID, where we are discussing, a lot of issues to do with COVID, but mainly talking to survivors, people who have suffered from COVID, sharing their experiences, hearing more from them. As we go on, we're also going to talk to institutions to find out why, after so many months of COVID, Bulawayo still does not have, institutions that can treat serious cases of COVID. It's actually said that as the, disease is ravaging, people are dying, we see an increase in cases. We have also seen another pandemic, which is misinformation. There's a lot of misinformation that is going on when it comes to COVID, a lot of theories, and it's actually said when we also see pastors, men of God, or can I say men of gold, encouraging people not to take the vaccine and telling us all sorts of, for a lack of a word, nonsense. Let me tell you that COVID is real. We have people who have lost relatives. We have people who have suffered from it. That's why we're doing this program. I am one person who knows what it feels to have COVID. And my heart breaks when I see people taking advantage of followers who have no information. As a pastor, you should know that people respect you, people follow you, people trust you, and they're going to do anything that you say. So I encourage men of God, men of religion, men who are worth to be called pastors, to really restrain or be careful what they say, because it might decide whether someone lives or dies. Anyway, enough of that politicking about pastors who are misleading people. But there's too much misinformation on social media, on Facebook, and all these sorts of things. Guys, forget about the G5 theories and whatever, revelations. COVID is there. And this is why we're having this program, to break it down for you. And today in my program, I'm talking to Zaydan. The pronunciation of the name is Randen. Zaydan Randen, and she survived COVID, so we want to hear from her what she has to say and what she went through. Welcome to the program.
Thank you for having me.
I think I would like to thank you for giving us this opportunity to talk to you. I know a lot of people who have suffered from COVID, they don't want to talk about it. My first question would be to you, why do you find it so easy to talk about your experience?
I don't think there's anything to be embarrassed about talking about my experience, what I went through. I feel that a lot of people in Zimbabwe especially, they tend to stigmatize people who have suffered from COVID. But I was not afraid of telling people that I had COVID or posting it on my Facebook stories or on my WhatsApp or Instagram. It came with ease. I didn't have a problem because I just want, if I can reach out to that one person who didn't think COVID existed, I'm a happy person. I know so many of my friends didn't believe that there was COVID until I got sick. And I told them when they asked me what was wrong with you, because I went AWOL on Facebook, I went AWOL on all social media, I was not there. I literally just died. And then when I came back, I told people that I had COVID. One of my friends was like, "What? Are you serious?" I said, "I'm serious as a heart attack," because I gave it to 3 other people, unfortunately, and that one other person was my mother. And what my mom went through, I wouldn't want another person to go through that. And the worst part was knowing that if something happened to my mom because of me, I wouldn't sleep, I wouldn't survive it. I wouldn't survive. I don't think I would have survived anything, but we survived it.
Yeah, tell us, at what point did you then say to yourself, you know what, I have COVID, or I suspect I had COVID? What was going through?
Okay, first of all, I had a sore throat. And then I had a terrible headache. Okay, I suffer from blood pressure. So my blood pressure was just abnormally high. And my head was throbbing. And I had this nagging sore throat. And then I phoned my sister, who is a doctor in SA, and I said to her, "What are the signs of COVID?" And then she says, "You tell me what you're feeling, then I'll tell you if it's COVID or not." So I told her that I was tired. Half the time I was tired, and my throat was sore, it was scratchy, and this headache, and I just felt like I couldn't move. And then I had a running tummy as well. Remember when COVID first started, we used to see a lot of people buying tissue paper, and we were wondering what was the tissue paper for. I figured it out, what it was for, because I had the runs. And so I told my sister, and then my sister said, I think you have COVID. You should go and get tested. But I was so afraid to go and get tested because when I go to work with about 4 people. So I said to myself, if I'm sick, that means the other 3 people that I give a lift to are also sick. That means my daughter is sick. That means my helper is sick. That means my mom is sick. So I started thinking, like, okay, so if I'm sick, I'm going with a lot of people, and that I couldn't stomach that. So I stayed at home for the first few days, and I thought I'm gonna be okay. Then it got worse. Then my mom started coughing. She's like, Zizi, I have your cold. You know me, Angola flu, but this time around, I don't know what's going on. And I said, Mommy, I'm so sorry. I'll give you antibiotics. So I brought her antibiotics, but she started coughing, and her cough was bad. So I brought her cough mixture. Cough mixture didn't work, antibiotics didn't work, painkillers didn't work, nothing worked. So I couldn't even go and see my mom. She couldn't even come and see me. But on that day, that particular day when she really, really got sick, she said to me, I think I need an injection. So I laughed and I said, Mommy, how can you need an injection for flu? It's just flu. She says, but I think I need to go to the doctor. I said, Mommy, don't worry. You worry too much. So I let her be. Monday I was supposed to start work because I was on leave. And then I spoke to one of my colleagues and I said to her, I fear that I've got COVID, but I haven't tested. And then she said to me, you better go get tested before you come to work. So I said, okay. On Sunday, I decided to go and get tested, but it was a rapid test. And he said I was negative. So I got such a relief. I was like, okay, so it wasn't COVID. I got so excited, but I was still sick. Okay, Monday, I go back to work. And then whilst at work, I am so fatigued. I'm so tired. I've got a headache and I'm constantly coughing. That nagging cough. And people don't want to be next to you because you're coughing or you're sneezing and all that. Yeah. Unfortunately for me, I don't share an office with anyone. So I was okay being all by myself. And my father had already started telling us to drink concoctions, ginger, honey, lemon, garlic, onion concoctions, and to steam. And Monday, I think I was at work, right? Then I decided after work, let me go and see my mom. So before I went there, I said, Mommy, do you need to go to the hospital? She says, yes, my child. That's when I knew that whatever my mom has is worse than what I have. So I went to see my mom. She was bad. I took her to Matide. When we got there, they already said this is a COVID patient because my mom's symptoms were now worse than mine. Then we're like, no, this is a COVID patient. We have to isolate her before we do anything. And I was so tired. So I decided to sleep on the those chairs that she sat by because they wouldn't allow us into where she was. I think we left Matide around 2 a.m. and we went home.
So she was admitted?
No, she wasn't admitted because the test was going to come out the following day. They had done all the tests and they said she had acute pneumonia, because my mom's symptoms were worse than mine. So, and me, because I thought to myself, I'm okay, so I'm not sick, so I didn't need to test. So that was Monday. And then we went back home. I went and dropped off my mom. 6 o'clock I had to be up for work. Got up and went to work, but I was so tired. I remember my boss asking, because I was talking to a colleague and I said, I'm feeling so tired. Then my boss like, what happened? And then I told her that we spend most of the time not today. My mom is not well, blah, blah, blah. And then she immediately said, oh, okay, you stay in your office for today. I don't want you in my office. So I said, okay. But we were just laughing about it. So later on 10 o'clock, I get a call because I'm my mom's next of kin. So they're like, your mom is tested positive and you are the one who was handling her. You might as well test. You and your daughter and your helper, everybody that you were in contact with needs to test. So I remember I cried. I was like, oh my God, my mom is sick. What should I do? I panicked. I started phoning all her relatives, because the last time she was sick, they were blaming me for not telling them that she was sick. So I phoned all her relatives and I started saying, Mama is sick. You know, little did I know what was coming for me.
So
was worse.
At that particular time, you know, maybe she got this cold from you.
Yes, I
but
knew
you
she
don't
got
think
it. No,
you don't think you've COVID.
I've got it. I knew she got this cold from me. So when they said she had COVID, I said, which means I gave her this COVID, but then I tested negative, so it can't be me. And then anyway, I go home. I came back, so because my boss said, you know what, you and the people that you give a lift to need to go. You need to isolate. So I said, okay. I told all my girls, I said, let's go. We all came back because we all stay at the same flat. So I got home, I changed, and then I told my daughter and my helper that please don't go anywhere. No one is please don't even go to the shops. Do not go anywhere. Just stay in the house. Then we went to see my mom. No, sorry. I went to buy her medication, azithromycin and other stuff that the doctor had ordered. So we got home and my mom is in a terrible state. And I said to Mom, you need to go to the hospital. I'm telling you, if it wasn't for my dad who said, do not take Mom to the hospital, I don't think my mother would have survived. But she survived because she was at home. At home, we were giving her all the care she needed. She needed to steam. We were doing that, which I think when you're in hospital, you don't do. No one will come to you and say steam. No one will come to you and say, here's a cup of whatever, drink it. No one is going to do that. But at home, especially if you're surrounded by your family, I think they will help you. And the helper that was there, she also didn't care that she was going to catch it or not, because the other helper had already caught it. So it was my mom, the helper. The helper thought she also had a flu. Fast forward, this is now like on, this is Monday, this is Tuesday, right? And then I leave my mom and I say, Mommy, let me go back home. I'll see you in the morning. Then I decided Wednesday, I'm gonna go and test again at Matide. And I went to get tested. The following day, before I even got the results, that very night, I started having a fever. I started getting sick. It was hot. I was shivering. I wore a onesie because I was cold. I was freezing, and it was terrible. My head started. It was like it was splitting. I was crying. I didn't even know what to do. Then I remember my daughter was now crying as well. And then I started throwing up. Continuously, I started throwing up. I don't know what was happening. I was throwing up. At the same time, I had the runs. My stomach was running. So I was carrying a bucket, throwing up, and I'm having the runs at the same time. I'm sorry to say this. It was gross, but there was nothing I could do. As I'm throwing up, first time I threw up in my bedroom, and I said to my, please don't touch it. Just let me be. I'll clean. But I didn't have the energy. So I went to the toilet, I took a bucket, and I started throwing up. And the runs, it was throwing up, runs, nosebleed. You can imagine all those things happening at once. I started crying because I didn't know what was going on. So my daughter's like, she phones her grand, she's like, Mommy's crying, I don't know what to do. My mom is also sick. My mom was like, what can I do? I can't even come there. I'm also sick. My mom phoned one of my relatives and said, Zayda is not feeling okay. Please, can you just go and check on her? She's crying, because I honestly didn't know what was happening. And then I crawled to the bedroom. I went back to the bed to try and sleep. I tried to sleep, but I just couldn't sleep. I was tired. I was constantly tired, but I couldn't sleep. I couldn't eat. I lost weight. Guys, within 3 days, I think I lost like 5 kgs. People were like, okay, because they're used to me this big. So all of a sudden, I've got this like a small frame. What's going on? In a case of 5 days, and I'm that sick. Imagine I had taken my mom to the hospital. I was okay. I still felt okay. 2 days later, before my results came, I started feeling so sick. And I started showing it that there's something wrong. So when they phoned me to tell me about my results, I already knew that I was sick. And then I figured that, okay, I'm the one who gave Mom the cold. And I'm the one who gave the helper the cold. So where did it come from? Okay, so I sat down and I said, okay, let me try and see what I did over the weekend. The Monday was my birthday. The previous Monday was my birthday. And then I thought, okay, I was with so-and-so on my birthday. Let me just call him. So I started calling my friends one by one. Are you okay? Are you okay? And then I explained to them what was happening. They were all scared, but they were all fine. Then I found a cousin of mine, who I won't mention. And I said, Kazi? And he's like, Kazi, Nyakwazi, why are you phoning me? I'm like, why am I phoning you? He says, you must have tested positive for COVID, because I also have it. I'm like, what? She says, I'm positive, so-and-so is positive, and so-and-so is positive. So amongst all of us, all 4 of us have COVID.
And these are the people who had gone
that
to
I was
there.
with. Yeah, that I was with. Then I was like, whew, okay. So we are all sick. She says, yes, but don't worry, because you'll be fine. Because she was okay. She was sounding so jovial. I said, because mommy's not okay. She's bad. I'm in a bad state, but mommy's worse. And then she's like, oh, no, because you'll be fine. You just take all your meds, take your vitamins, take all this stuff. You're going to be okay. Then I'm like, oh, no, because it's okay. Then I put the phone on speaker so that my mom could hear. So my mom's like, oh, you owe me a husband now because I'm going to die because of you. You know, because we still didn't know where we all of us got it from. But amongst, I think one of us, I don't know who had it, but they didn't know. So they passed it on to all of us. And that's how we all started getting sick one by one. So I was like, wow, okay, so I have COVID. I actually didn't see the need of hiding it from people. I told my family, my mom was telling other people, other family members. I remember my little sister's car was getting engaged, and I missed the engagement because the week before they thought I had bronchitis because I didn't have a voice. I couldn't talk. I was coughing nonstop, and the doctor's like, it's bronchitis. Sounds like bronchitis. So I then excused myself, and I said, Ka, I wouldn't want your guests getting sick because of me. So I'd rather not attend your engagement to save you and to save the people, your guests. Little did I know that I actually had it then, and I didn't know. So for me, talking about it and telling people or educating people about COVID, it's very easy, because what I went through, what my mom went through, what the helper went through, what my friend went through. I didn't tell you about a friend. There's a friend who was now in ICU, couldn't breathe. And it was admitted there, and it was bad. It was really bad. And that particular friend of mine, the car that he was driving, he sold it. So the person that bought that car started getting sick in Harare.
Wow. Just from the car?
From the car. The guy got sick. So he was like, listen, I bought a car from you, and all of a sudden I'm sick. Then the guy was like, I'm so sorry to have to tell you this, but I think you need to go and get tested. I should have cleaned the car before you took it, but he was already very, very sick then, so he couldn't do anything. And he never thought that the car would transmit the virus to him. So eventually that guy got tested, and he was sick as well in Harare. So from me, I guess I infected 5 people. This is just one person. I infected 5 people. So how many other people did these people infect before actually knowing that they had COVID? How many? This is what I keep telling people. They keep thinking COVID is not real. So one of my friends phoned me. She's like, are you at work? So I said, no, I'm at home. She says, oh, no, I wanted to buy a stove. But okay, fine. What's wrong with you? So I was like, I have COVID. She says, what? You have COVID? I said, yes. She says, no, you can't be. Is it that thing for real, for real? I said, yes, it's for real, for real. I have COVID, and I'm a witness. It's for real, for real. And trust me, you don't want to have it. And when I was looking at people's statuses in December, people jiving, people clubbing, people going all out, I actually felt sorry for them. And I knew this was coming. This January, this whole thing that's happening in January is because of what happened in December. People took COVID very lightly. They didn't think it would spread like this. They thought it was just a disease, only maybe 1 in 10 people are going to have, not even 10, 1 in 100 are going to have COVID. They never thought it was going to get this much. But it's their actions from December that's causing all this. If people had stayed at home in December, stayed with their family, not even with their families, just stay at home. No visitors, nothing. None of this will be happening. But we in Zimbabwe are taking COVID very lightly, like it does not exist.
You know, I remember talking to someone, telling them that, COVID is real. In fact, I posted on Twitter. The guys, I passed by a certain club and it was pegged. And do people still think that, do people realize that COVID is still there? One of the people who responded to me said, may those with the strong immune system win.
Wow.
And for me, basically was, okay, you might have a strong immune system if you know.
Yes.
But what about your parents?
True.
Your relatives who are older than you? Your friends who might be having cancer, who might be having other underlying conditions like asthma, like diabetes. In hindsight, looking at what happened, what do you think would have done better?
You mean
yes.
Or
when you're looking back, when what were some of your regrets? What did you regret? What would you say? I could have done this better.
Okay, yeah. With me, I'm that one person. Everyone that knows me knows that I'm a couch potato. I love being at home. I love just sitting and watching TV. That's me. So I don't go out. I don't go to parties. I don't do this. But the only time I decided to celebrate my birthday with my cousins and my friends, then I get infected. Just this one time. Once. And I got infected. So I started feeling bad. I started thinking maybe I should have just stayed at home. I shouldn't have celebrated my birthday. But my mom has always taught me to celebrate birthdays. So it's always something that I always look up for. When growing up, from when I was 1, I think, my mom was celebrating my birthday. So anyone's birthday that's close to me, I always celebrate. So it's not my birthday and I want to celebrate it. And guess what? I didn't get COVID as a present.
Yeah, I can imagine. Now you are sick, and tell me about, how was it like, in terms of watching TV, being on Facebook?
I was not even watching TV. That's why I said earlier, I was off social media completely. That's how a lot of people noticed that there was something wrong with me, because I'm always posting stories on Insta stories, WhatsApp stories, Facebook stories. I'm always posting on a daily basis. I just went AWOL. A lot of people noticed that there was something wrong with me when I went AWOL. When I was not online, I remember I even gave my daughter my phone. I said, you know what, please keep the phone. I think I had over 1,000 messages on WhatsApp, people trying to look for me, people calling me, but I did not even want a phone call next to me. The TV, I did not want it. I just didn't want anything. Do you know, I bathed twice, in the morning, in the evening, in the morning, in the evening. When I had COVID, I don't want to lie to you, walking from the bedroom to the bath was a nightmare. I couldn't walk. I was tired just to move from my bed to the bath. My daughter will literally say, Mommy, let's go bath. I'll bath you. You just sit in the tub and I'll bath you. And she would drag me to the bathroom. She would drag me and I'll sit there and she would bath me. I would just be sitting there, just laying there, not knowing what to do, thinking to myself, okay, if I'm going to die, are my things in order? I started thinking, okay, should I phone Econet? Should I do this? Because I'm one person that doesn't like to do these funeral policies, because I always say I'm planning for my death. So I don't want to plan for my death. So I started thinking, so what's going to happen to me? What's going to happen to my mom? What's going to happen to my siblings if I die? Or if my mom dies, what's going to happen? I started feeling bad that if my mom dies and it's because of me, if that friend of mine dies and it's because of me, what's going to happen to the kids? What's going to happen to the family? I had all these things running through my head. And I started thinking, you know what? I'm bigger than this. I've had 17 cystectomies. I'm not sure if you know that. Cystectomy is a surgery that they cut you here on a C-section to remove cysts in your belly. Yeah. I've had 17 of those. Lying in theater, thinking I won't survive. One time I went in and my blood sugar was very low, my blood pressure was high. They had to stabilize all that before I went in. One time the doctor made a mistake, he cut my intestines. I was in hospital for a month. So I said to myself, if I can survive that, I'm going to survive COVID. I'm a soldier. I'm not going to die because of COVID. This is not going to kill me. I should have been dead long time ago in theater, but I'm still alive. I'm not going to let COVID kill me. I started doing what I was supposed to do, because I was even lazy to steam. My daughter would tell my mom, she doesn't want to steam, so You know, she was now like fed up with me, like, do something. Can you steam? Help yourself. Because you're supposed to be by yourself. Who's going to help you? But she was there. Luckily for me, she was there. So she would steam me. I started steaming. I started trying to eat because appetite, I tell you, it's gone. You can't smell anything. You can't, you know, I love curries. I love to cook. I make sure that they put chilies like, and I couldn't taste the chilies. I kept saying put, and I couldn't taste the chilies. My blood pressure started shooting up, you know, shooting up deadly. And that was one thing that was going to make me get admitted. It was my blood pressure because it was too high. And the doctors kept saying, this is dangerous blood pressure. You can just stroke right now. We need to admit you. I refused. I said, I'm not going to the hospital because the hospital is saturated with COVID. Imagine you get admitted in a COVID ward. Everybody right there has got COVID. The air you breathe has got COVID. How are you going to survive that? And don't think that the isolation room has got plastic covering you or what. No, it's just a ward with patients with COVID. All of you have COVID. When the nurses come, they just throw your food there. If you eat, if you don't eat, it's on you. So if I'd gone to the hospital, if my mother had gone to the hospital, she wouldn't have survived.
You know, you mentioned a lot of very important things, but one of them is the positive thinking, you know, and also the help. You know, I realize that people always say when I tested positive, those who were advising me say, no, isolate yourself, don't mix with family, and you have I have a son. And you always come and talk to me, and the family was there, you know, and that makes it a difference.
Better. It makes it better.
Despite the fact that they know they have a chance of getting it, you know, and well, my son didn't, and the family didn't.
She also didn't.
Yeah, so it's maybe they had or they didn't have, but when they tested,
they were okay.
The city council results never came.
The unfortunate part, as well as me, when my mom tested positive the first time, the doctors at Matade said that city council will visit you, right? They never came. Till today, they didn't come. We had to go to them. So by right, they were supposed to go to my mom's house in Machimhlope, test her, her helpers, and everyone around her, then come here. Because I would have exposed everyone in this flat. Because I work, all the ladies that I work with, I go with them to work. There's 4 of them. They all live in different apartments. I would have exposed their families as well. But nobody came to test us. Nobody came to check on us from city council. Nobody did that. So these statistics that they're saying they have, they are actually false. There is more people that are sick than what is being said. There's a lot of people that are sick out there and they are not being tested. One, the issue of the $60 that you have to pay, where do you get $60 from? To test for COVID. You have to test, you have it, you have to test again to get cleared. For me to get back to work, I needed to be cleared. I first needed to have a COVID a certificate to say I'm negative. Take that certificate and take it to city council so that they clear me. Mind you, the other thing that I think most companies are not aware of, once you test positive for COVID, you are not sick like you have flu, you have a running stomach where a doctor writes you a sick note. No, that does not count. You do not get a sick note when you are sick with COVID. You get a clearance letter from city council. So what most companies are not aware of is that you cannot go to the doctor and say, can I have a sick note to take to work? Because work will expect you, they will expect something, some form of communication that you're not at work, right? But you on the other hand, cannot go to the doctor to get a sick note. So city council is supposed to come to you, but do they come? No, they don't. So I had to stand up again and go and look for city council to say, okay, I want to go back to work now. And no one has come to my house. No one has tested anyone I live with. No one has come to test my neighbors. We use, I mean, you can see the stairs. Everybody touches the stairs when they're coming up. No one has come to check anything in this flat. We could all be positive, and really, because people are not tested, how will they know? And this is how so many people are spreading it. So many people are positive, but they are not aware of it. They are sick going around spreading it with their family. And the unfortunate ones, not because your immune system is better than who's who, it's not. The unfortunate ones will die in a matter of 2 days. A friend of mine lost his dad the day before yesterday. He had diabetes, and then he went to the doctor. They decided to just test for COVID. He tested positive. That very night, he passed away. So imagine that man, he was surrounded by family. How many people did he interact with in that family that he probably left that COVID with? So I know that maybe most probably we don't have that kind of money to go around testing people, but something needs to be done. You know, something has got to give. People are sick. People are dying in their homes. The statistics that we are seeing every day, those are lies. There is more people with COVID than what is being reported. And there's more people in companies that are sick that don't know.
You talked about care. You need food, you need tablets, you need this and that. You are now locked up here. One of the challenges that I realized was just going to the shops to buy food. Because someone has to, and friends will not really, they are not available. For people who, the experience that I got was water comes once a week. So
by the way,
we ran out of water. And we needed water.
And then you have a running.
It's a story for another day. But the fact that you're isolating. You have told the few friends that you have that guys have COVID. Then you call them and say, who will come?
No one will come.
So it's those problems. But how was it for you, knowing that you need supplies and you are isolating with your kid here, and and you're now thinking maybe you could get a COVID. No, but we are also in isolation because at one point you break the isolation.
Yes. I think fortunately for me, I have a very good family. My family is so united when somebody is sick. So my family didn't care that I was sick or whatever. They did not care about that. They would ask us what we needed and they would deliver. Like in terms of food supplies, my uncle would bring the food, he will bring the juices. He will come here for me, he will go to my mom, my brothers. I've got my brother who stays in North End. He will check up on me every 2 hours. Sometimes I would say, please, Tando, answer the phone because I cannot talk. My family was there for me, I don't want to lie. And my family was also there for my mom. Fortunately for us that live in town, we don't have water cuts. So water was okay. But ever since the water thing started, we've always had this thing of buying water, drinking bottled water instead of city council water. The running stomach I had, I honestly didn't know what was causing it. The one thing I forgot to mention was I couldn't see. I sort of lost my eyesight for a while. It was blurred. It was like ngangilo bulembo. And each time I'll say to Tando, I can't see this, or come and wipe the TV. I can't see clearly. And then she'd be like, it's okay, mommy. I said, no, it's not okay. It was blurred. So then my mom later told me that it's one of the side effects. I didn't know about that, about the losing of eyesight, but I couldn't see. But after I got better, when I was now okay, my eyesight went back. But you remain with fatigue. You're always tired. You get tired so quickly and people don't understand why you're tired. But it's this is the devil himself. COVID is the devil. I keep telling people that I feel like COVID is God's way of trying to tell us something. He is trying to send a message to us, but we are still not listening. And because we're still not listening, a lot more is coming. There's a lot more deaths that are going to come. What did they say? What's that saying? It gets, what's that saying?
Darker before it's dawn.
Yeah, exactly. Yeah. This is what is happening right now. This is what we are going through right now. Fortunately for me and the people that were helping me and helping my mom, assisting my mom, none of them got COVID. The only one person that got COVID was one of my mom's helper who got COVID. And when she left to go to her house, they thought it was TB because she was coughing a lot as well. So when I then called her to say, Mom tested positive for COVID, so which means you most likely have it. I think she then also tested positive. But those are the only people that I can say from me that I gave that disease to. But I think also when you have COVID, you naturally, as a person, when you get sick, the only thing you think of is death.
Yeah.
You just think, I'm gonna die. I'm gonna die. It's like when you're going to theater. Every time I used to go to theater, I'll be saying, I'm gonna die. I'm gonna die. And each time I woke up, I'd pinch myself like, oh my God, heaven looks like home. I'm in heaven. Am I in heaven? Like every time I go into theater, I would think I'll not wake up because of my diabetes and my high blood pressure. Sometimes my blood pressure is very high, my sugar is very low, and they have to stabilize that before they operate. And they'll tell you that this person will take longer to wake up because of her diabetes. And sometimes I'll stay for about 6 hours still sleeping. And then when I finally wake up, my mom, I thank God for a mother like mine. My mother has been there for me throughout all my ordeals. I don't think if my mom was not alive, I would be alive right now, because she's the one person who gives me strength. Even when I was sick that time with COVID, I remember if I called my mom and I say, Mommy, this is what is happening, as sick as she was, she'll say, my child, you're going to be okay, okay? You just have to go through this. Let it go through it. Ride the storm, but you're gonna survive it. And because my mom said that to me, I survived it. I believe in anything my mother tells me. I believe she's my, I don't know what to call her. She's my, if there's a word, but she's the one person who gives me strength each time I'm sick. Uska, my little sister, will tell you, sometimes I'll just collapse because of my blood pressure. So you can imagine, you have high blood pressure, you have COVID, and your blood pressure is just shooting up. The next thing, my child will come, she'll put a finger underneath my nose to check if I'm still breathing. Because, blood pressure is a silent killer. Because sometimes I'll just sleep and sleep. The other thing, they were scared that I'll end up choking because of my own bleeding, nose bleeding. That's another thing that was happening to me. I don't know if it was happening to other people. I started nose bleeding a lot when I had COVID. That was one of the other signs that I had. I started just nose bleeding. At night, I started nose bleeding. I started swallowing blood. I wake up, there's blood all over me. It's coming out from my mouth. It's coming out of my nose. It was hard, I tell you.
I really didn't go through what you went through. When each time I hear other people's stories, I always say, okay, my experience was.
You feel like yours is better.
Mine was better.
Yeah.
And how many days were you really flat sick?
I can say, I think close to 6 days. I was really sick. I was tired. I couldn't eat. I think that's when I lost weight, because I could not eat anything. I couldn't put anything in my stomach. The only thing that they were forcing me to drink were those concoctions, and then there's Life Gain. Life Gain is one other thing that helped me gain my strength, because I couldn't eat. I would force myself to drink that Life Gain. That was my only food. And the concoctions, the lemons. I tell you, I think, because if you notice, when this COVID thing started, lemons have been in short supply. And
they're now expensive.
Yeah. So my father had to send us lemons from South Africa. Send us lemons, send us the drugs, send us the eucalyptus oil, the Vicks to rub, the vitamin Bs, because you have to take this. You need to take zinc, vitamin B, vitamin C, vitamin D, and what's the other one? I think there's 4 of them that you need to take. Even now, even for people that don't have COVID, you need to start taking those, especially if you start feeling like, or you've been exposed to somebody with COVID. I'll suggest you start taking vitamin C, you steam, you start eating healthy. The other thing that COVID has done, it has exposed our bad eating habits. That's what it has done. We are so unhealthy as a nation. The people drink I don't know. We eat fatty foods. We eat, oh God knows what. And that on its own, when you have COVID and you're eating all those foods, you've got high blood pressure.
Tell me the day you felt like, I always tell people that there were days where I felt like,
I was dying.
Planning a funeral or something.
That day.
So tell me about the day you said, Namta, I'm dying, and I'm telling people that I'm going.
It was that day when I was throwing up, At the same time, first I started throwing up at night. You know, you throw up. Throwing up is very painful.
Yeah.
I started feeling like my belly button was not being pulled a lot. There was nothing left in the stomach for me to throw up, but I kept throwing up. And my stomach couldn't stop running. And I couldn't breathe for some time. I was panting. Half the time. And then I thought, yeah, maybe I am dying today. And then I said to myself, you know what? I've always asked God for this opportunity that the day I'm dying or I'm about to die, He must give me a chance, to ask for forgiveness, to make my path right with Him, so that I'm found with the righteous one. So I said to myself, okay, let me do this. Let me confess my sins. Now ask for forgiveness. That's why I keep telling people right now, love the people. Right now, as if it's your last day. Live every day as if it's your last day on earth. If you've got people that you don't talk to, your family or friends, forgive them and move on. Don't hold on to grudges, because tomorrow is not promised to anyone. You will wake up dead.
You're mentioning something very important, that when you are there, you are sick, you look at your child and you say, you start seeing everything differently. If ever I recover, now I'm going to do this, I'm going to do that. You see life totally differently, in a very different way. And you start saying, but why have I wasted my time all along not finding all this? Tell us about the things that you really say, when I recover, I want to do this.
Oh, there's a lot. I said I'm going to get rid of bad apples in my life, but I think I have managed to do that. I am going to live my life as if, like I said, as if it's the last day. And I'm going to love whoever loves me. And I'm not going to waste any time overthinking things. If something is meant for me, it's for me. We Black, we've got this thing of utandu mali, as if, I don't know what we'll be thinking, like what's going to happen when you die. You leave that money. So I started telling myself, you know what, I'm going to spend in whatever I want. If I feel like I want to buy ice cream today, that's it. I'm going to eat ice cream. If my child wants to have her hair done, let her have her hair done. If she wants to wear this or she wants to buy this, let her. But obviously, you have to guide them. You can't just be okay with everything she wants. But you need to guide. You have this clarity. You have this, what can I say? Everything that it's like you're a new person. Yeah. You think clearly. You even appreciate God. If you never used to pray, you start praying more.
The silent prayers.
Yeah, the silent prayers. You'd be thinking. I honestly, in all honesty, I think my mother's prayers are the ones that help me, because sometimes I always say to God, but why do you make me go through such things in life when there are others that are out there living their lives like they don't care, and they keep being blessed by, so many things. But here I am trying to live a good life according to your will, but I still keep being punished. I still keep going to the hospital, getting cut. Why? Why me? And then again, after having gone through all these cuts, you are making me go through COVID. As if all those things that I've gone through are not enough, you give me COVID. I'm always like renewed. It's like a rebirth. You want to do things differently. You want to love more. You want to visit more. You want to travel more. Unfortunately, we can't travel.
Yeah.
But you want to travel more.
Exactly.
You want to travel more. You want to, do whatever you feel like doing. Do it. And if there's a girl that you like, that you never told that you like, go and tell her that you like. You never know. Maybe she might like you back. If there's a person, a relative that you're not talking to for whatever reason, go and apologize. Because sometimes we inherit our father's problems and whatever. We won't be knowing why our families are not talking to so-and-so. Be the different one. Go and talk to them. It doesn't hurt. I always say, saying sorry to somebody doesn't hurt. It doesn't hurt. It doesn't take out anything to you.
So now you have recovered, and how has it been? And are you fully fit, or you still?
Free. I'm not really fully fit per se, because I've got my days. I'm always tired. That's one thing. I feel tired half the time. I feel like I want to sleep. constantly I just feel like I want to doze off. I'm just tired, I want to sleep. But even my mom also suffers from these dizzy spells. Like constantly she just falls. And my mother has got she's paranoid now. She will phone me and ask me, where are you? Please don't be going to Chicken Inn, don't be going to supermarkets. I'm like, Mom, but one way or the other we have to go to Chicken Inn or to Pick and Pay. One of the things I noticed was when I went to Pick and Pay, I said to them, listen, having survived COVID and watching you guys do your things, COVID is being spread in your supermarkets. Then they were like, why? I said, first of all, I come from wherever I'm coming from, I get a trolley from the end there, right? And I push it. That trolley is not sanitized, it's not nothing. Then the guy tells me, no, we sanitize our trolleys every morning. I said, oh, so are you telling me that that trolley is going to be used by one person? Okay, fine. I get there, you sanitize me. I push that trolley. I go to the vegetable store. I want an apple. I start touching it. I want a banana. I do this. I want a milk. I start looking at the expiry dates. I want eggs. I'm checking which ones are fresh. I want bread. I do this. So what's going to happen? And you become very paranoid. You end up spraying everywhere you're going. I carry that tin now. Everywhere I go, I just spray. When I get to Pick and Pay, I first spray. I spray the thingy, and sometimes I feel like even wearing gloves, but then that would be crazy. But the moment I get in the house, I wash my hands. Well, that's always been me. Before COVID, that's how I've always been. Before I do anything, the moment I get into the home, I wash my hands. And I'm one person that has always had sanitizers in their pockets.
What would be your advice to someone who's going through COVID or who suspects that they have COVID?
If you suspect that you have COVID, first thing you should do is, I think, vitamins. Start taking vitamins and start even jogging if you can. Light jogging if you suspect, because COVID, the other thing about COVID, makes you lazy. It makes you like if we have a fatigue. So imagine like COVID and you're lazy and you're fat as me. You just sleep, you carry on sleeping, you won't win it. And also you need to have a positive mind. Don't tell yourself you're going to die. Don't start planning a funeral. Don't start thinking positive. Start thinking of the things that you want to achieve. Start thinking about your kids. What you want to see your child going to university. You want to see your child getting married. You want to see this, you want to do this, and then do it. Get up, walk to the toilet, walk and bath. If you need to bath, eat. Force yourself to eat. Even if it's a spoon or it's a boiled egg a day, eat it. Even if it doesn't have taste, because the taste buds are gone. You just eat. So for somebody that has COVID, I think you have to think positive. That's the first thing. Think positive. Because if you start thinking negative, it will start weighing on you. You will see yourself as a corpse. You think you are dead when you're walking, And the other thing, you need to surround yourself with people that actually love you. But unfortunately, COVID, you have to be alone. You have to suffer alone. But I find that it's the other way around. You need to surround yourself with family, And I was fortunate enough that I was surrounded by family and with people that cared for me. And they looked after me. They didn't care whether they're going to get it or not, or what was going to happen to them. They looked after me. They looked after my mom. My support system was very tight, I must say. I'm so happy that I had a lot of people from all angles helping me and my mom. We fought this, and we are here to educate people about COVID. And I will not stop talking about COVID or telling people that I had COVID. They shouldn't run away from me when they see me or whatever and think I'm going to infect them. Or if I'm coughing, a slight cough, and they think, oh, okay, Zayda has COVID, she might give it to me. No, I might actually help you. Because for now, I think I'm the safest person to be around than anybody else, because I just had it. So for chances of me getting it now, they're slim, but I might get it. But not that I'm saying I won't get it, but they're slim. I'm the safest person to be around right now. It's unfortunate that when you tell people that there's COVID, or when they see other people dying, whatever happening, they'll be like, you know what I mean? So they're not bothered. Not knowing that it can come knocking at your door when you least expect it. And some have got babies, babies. Imagine a child having COVID. That's not a nice sight, guys. That thing is horrible. It's horrible. It's the devil himself. It's the devil. So be positive. Try and surround yourself with people that really love you. In actual fact, that's when you see the ones that really like you, the ones that love you, and the ones that don't care about you. You see them when you go through this. It all comes up. So I was surrounded by love, care, by a lot of people, my friends, my boyfriend, and yeah, I'm happy. He made me go through it. I think he was giving me strength. And my daughter, my mom, I helped her. She was cooking for me, and she didn't care. She would come into my room and give me the food, force me to eat, but she never caught it.
Thank you very much for giving us this opportunity to talk to you and learn, because every day when we talk about COVID stories, we learn something different. COVID, affects people differently. And there are a lot of things that I didn't know, even the issue of the eyesight. To me, that was something new. Thank you for such an enlightening discussion. There you have it. This is another story about someone who survived COVID. And unfortunately, there are some people who will never be able, or who will not be there to tell the stories, because they would have died of COVID. So I know where you are today, you might be fine, and you think COVID is real, and it is only us who can try by all means to make sure that we don't pass it to another person when we have it, or we don't have it. So we always encourage people that where possible, stay at home. But if you have to work, you have to get in town and do other things, wear a mask the right way. Vala umlomo namakhala. This business of doing this, or ukufaka mask lapha, and abanye bayifake engalweni bese bethwala handbag as if it's fashion, I think we really need to get serious about this issue. So wear your mask properly, cover your mouth and your nose, sanitize each time you touch surfaces, and keep a social distance. Keep a meter or two apart, or 3. Because I've seen that, like I always say, when people meet at work, 2, 3, mask and people are now going for tea, they don't wear a mask. Guys, people are dying. Imagine this week how we have, I don't know how many people have lost this week. We keep counting every day. At one point this week, we recorded 60 people in 24 hours. At least someone that has died of COVID. And someone has been sick of COVID. So why can that change you? Because the virus doesn't go. It's us who move from one place to another. And if you avoid movements, then we also reduce. If we avoid gathering unnecessarily, I know we still have family functions, but when it's a funeral, only go when it's necessary. And when you go there, practice social distancing. My name is Zenzele Ndebele. Till we meet again next week, where we'll be looking at other COVID-related stories. I urge you to stay safe. Remember to tell the next person to wear a mask, social distance, and sanitize. Have a good day.
Basic information on COVID-19. How can one tell if they suspect it? The case definitions are based on the current information available and will be revised as new information accumulates. Suspect case. A patient with acute respiratory illness, fever, and at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and a history of travel to or residence in a country or area or territory, reporting local transmission of COVID-19 disease during the 14 days prior to symptom onset. C. A patient with severe acute respiratory infection, fever, and at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and requiring hospitalization and with no other etiology that fully explains the clinical presentation. Confirmed case. A person with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. The City of Bulawayo Health Services Department, HSD, requires your cooperation and assistance in ensuring that suspected cases are diagnosed early and necessary infection control measures and contact tracing are followed to prevent the spread of the disease.